So, good morning, ma'am, sir. We will be now performing the procedure, moving the client into lateral or prone. For the definition of this procedure, this procedure involves repositioning a client from the current position, like the spine, or to either or a lateral side, which is side lying or prone, face down. Position will often done to relieve pressure, improve breathing, and for specific medical instruments or treatments. So, my name is Justin C. Custodio alongside with my co-student nurse, Ivan Bahala. We will now do the lateral or prone. Next is the objective, which is to safely move the client to a lateral or prone position. Second is to prevent injury to the clients or the healthcare providers, and to maintain clients' comfort and alignment during their proceeding.
So for the safety and security measure for this procedure is to ensure the bed is at safe working height. Wheels are locked and the side wheels are raised and used appropriately, and use proper body mechanics to prevent injury to the healthcare provider, and communicate clearly with the clients and any assisting personnel. So for the pre-procedural preparations for this procedure first is to wash the hands, introduce yourself to the clients and identify the client's identity, and explain what are you going to do, why is it necessary, and how the clients can cooperate. And after that is to gather the necessary equipment, provide clients privacy, and observe proper body mechanics. So, good morning, ma'am. So, ako din si Ivan Bahala and my co-nursing student nurse, si Justin Custodio. And maybe ask mo sa inyong name. So, good morning, Ma'am Aishi. So, today kay naami parang sa imong side kay mag-moving knee to lateral or prone position sa imo. And maka-cooperate ka namin ma'am by following our instruction, pero kung dili ka nasa mga instruction ka, pwede ka mag-voice it. So, may question mo.
So, let us proceed for the procedure proper. First is position yourself and the clients appropriately before performing the procedure. This ensures that the initial position of both of the nurse and the clients will help to ensure safety and effective start of repositioning that avoids any injuries or strains towards the patients and the healthcare provider. Next is move the client closer to the side of the bed, opposite to the side of the client. Face one turn.
So, pa-cross lang and then, i-move lang mo ka ma'am side mo ma'am. So, doon na ito yung comfortable.
Go.
So, comfortable lang na.
This ensures that this provides adequate space to the side when turn will occur, allowing the nurse to position the client safely and correctly.
So, next step is while standing on the side of the bed, nearest to the clients, place the client's near arm across the chest and abduct the client's far shoulder slightly from the side of the body. So, the rationale for this is that placing the near arm across the chest prevents it from being trapped or injured during the turn. So, abducting the far shoulder slightly prepares the client body for smoother flow. So, alam natin and after that is to place the client's near ankle and foot across the ankle, across the far ankle and foot. So the rationale for this is that crossing the legs helps to prevent the client's lower body from splaying out during the turn and maintaining a more stable and aligned position.
Then, raise the side rail next to the patient before going to the other side of the bed. Since I have my co-student nurse, so ako student nurse ang mag-assist in raising the bed rails. Assuming that they also raise the bed rails there. Then, The rationale for this is crucial safety step to prevent the clients from falling or accidentally rolling off the bed. The next is position yourself on the side of the bed towards which the clients will turn directly in line with the client's waistline and as close to the bed as possible. This ensures that positioning allows the nurse to use their body weight effectively and apply force to the client's center of gravity, which is the waistline, maximizing minimizing the strain and maximizing control during the turn. Being close to the bed reduces the leverage needed.
So incline your trunk forward from the hips and flex your hips and knees and ankles. Assume a broad stance with one foot forward and your weight placed upon the forward board. And the rationale for this is that this utilizes proper body mechanics, engaging the larger muscles of the legs and trunk for a stable and powerful movements, thereby protecting the nurse's trunks. And place one hand on the client's far hips and the other hand on the client's far shoulder. So the rationale for that is that holding the client at the hip and shoulder provides the best leverage points control the client's body as a unit, ensuring a smooth and aligned flow. So 1, 2, 3, go.
And tighten your gluteal abdominal, leg and arm muscles. Rock backward, shifting your weight from the forward foot to the backward of the foot, rolling the clients onto the other side of the body facing you. This engage the muscles, provide stability and strength, and your shifting weight smooth and coordinate with the client's body allows for control and minimizing the risk of injury and maintenance.
So next is the variation, turning the clients to a prone position. So to turn a client to a prone positions, follow all the steps above with the following alterations. So instead of abducting the forearm, keep the client's arm alongside of the body for the clients to roll over. And roll the clients completely on the abdomen and never pull a client across the bed while the client is in the prone position. So the rationale for this is that pulling a client in a prone position can cause significant frictions, shearing, and misalignments of the spine, leading to injury. And movement should be coordinated through. And the third is a small pillow can be placed under the client's stomach. You can also place a small towel under the shoulder of the client's surgeon's pressure. So the rationale for this is that this supports help maintain spinal alignment, the prone positions, and relieve pressure on bony prominences, improving comfort and preventing skin breakdown. So ma'am, ipasahid lang natin yung arm count and then i-mag-count mo yung 1, 2, 3 ma'am para amo kang hero kung go. So ingon lang ka ma'am, hindi ka comfortable ma'am na. So pa-cross lang ka ma'am. Mga kakada sa and then 1, 2, 3. Oops. Then pasahid yung ano ma'am. Then after that is 1, 2, 3. Then pagputang lang muna sa inyong upstairs sa mong tight ma'am. So comfortable na ka ma'am.
Then put another pillow under the lower legs to prevent pressure on toes. This ensures that elevating the lower legs slightly with the pillow can help relieve pressure on toes and feet, especially when the client is in a prone position for an extended period. Then wash your hands. This ensures that it prevents the spread of microorganisms and protects the healthcare provider and the clients from cross-contamination. Then lastly is to document the procedures done. This is to accurately document the records that the care provider did and the client's tolerance to any of the interventions or the procedures that we agreed and which is essential for the continuity of care and the legal purposes. So, thank you kay ma'am sa imong cooperation. If I